previous segment, we took stock of the healthcare situation in India and an initiative called the Piramal Prize aimed at encouraging innovative ideas in the field of healthcare. The Piramal Prize seeks to enable cutting-edge entrepreneurial ideas that bring the highest standards of health to India's masses. Business models that aim to win the prize should ideally emphasize profitability, sustainability, and maximum impact on the social sphere. The most viable business model will receive ₹1 million in seed funding in addition to potential venture capital. All business models need to directly or indirectly address the health crisis in India.
We were so surprised. We got 300 applications, and they came not only from India, they came from Stanford, Harvard, Oxford University, they came from the UK, they came from all over the world.
Looking at the myriad problems that the country faces today, the Piramal Prize attracted some innovative solutions and business models that addressed a variety of issues like anemia, water and sanitation, providing affordable eye care, etc.
There are incubators which we looked at. There are companies which are trying to provide prickless diagnosis for anemia. So there's an interesting spectrum of companies who have already done a fair bit and companies who are just coming up across the whole healthcare ecosystem that we looked at right now, and it's very interesting.
It's not difficult to solve diarrhea, or it's not difficult to solve a cold. What you really need to do in India is to reach scale of proven solutions, and that's what this prize tries to do. And I think it's a great way of looking at it, because if you are able to democratize and reach scale, that's what really India needs. It doesn't need the most complex technology, it doesn't need the most complex solutions, etc.
According to the National Family Health Survey, India has the highest number of cases of anemia. As many as 79% of India's children between the age group of 3 and 6 are found to be anemic. Furthermore, almost 20% of maternal deaths are caused directly because of anemia.
Okay, let us understand how serious is the problem of anemia. Statistics tell us that 30% of world population is anemic. That's over 2 billion people. Coming to India, about 79% of children between age group of 3 to 9 are anemic. Almost 56% of females in the reproductive age group are anemic. Now if you look at how anemia really affects the maternal mortality rate, 20% of the maternal mortality rate is directly due to anemia, and 40% is indirectly due to anemia. In the sense, almost 40% of pregnant females all the deaths taking place in pregnant females is due to anemia or some related causes.
Keeping this in mind, a team of doctors and engineers came together to combat this problem. The result was Animedia, a socio-technological enterprise that hopes to resolve the problem with the introduction of Animedia Scanner. Animedia Scanner is a lightweight biomedical device that measures hemoglobin levels in the blood without having to extract blood to help diagnose anemia.
So our idea was to equip our scanners, to equip the Anganwadi workers with such scanners. So they could actually take on home screenings, monitor the level of anemia, and if possible, refer them to the nearest sub-center or the PHC.
The health worker in the PHC checks the value of hemoglobin, compares it with a given chart, and provides a dosage of iron tablets to the patient if required. The health worker then monitors the treatment of the anemic patient at regular intervals. The tracking of improvements is vital in case of pregnant women to reduce the number of maternal deaths.
Almost all forms of hemoglobin estimation right now used in India involve pricking the patient, bleeding the patient, taking blood, taking a test tube and then analyzing it. So ours is a prick-free system. So you get the reading in 5 seconds.
The other enterprise that caught the jury's eyes was Arvind Eye Care. Founded in 1976, Arvind Eye Care System today is one of the largest eye care facility in the world. Arvind Eye Care was established with the intention of providing affordable eye care to the poor and rural masses. The institution started with 11 beds, which has now grown to over 3,640 beds with a network of 5 hospitals across Tamil Nadu and Pondicherry.
This project is called Vision Centers. This project is basically aiming at providing primary eye care services in a comprehensive manner to the rural population of 50,000, which is again blended with the technology and innovation. That means we are linking the primary eye care centers in the rural areas with the base hospital with the tertiary care or secondary care hospital with the tele-ophthalmology, so that a common man from a rural village can get access to the ophthalmologist.
India shoulders the largest burden of global blindness, estimated to be 15 million. The most common cause for blindness is age-related cataract or refractive errors. And nearly 60 to 70% of the blindness in India is treatable.
Through the outreach activities, though we do enormous number of cataract surgeries, say 100,000 surgeries per year approximately, we could reach only 7% of the people who need eye care.
India has only about 12,000 ophthalmologists catering to its entire population. While 53% among these cater to urban areas, 43% work for rural areas. The ratio of ophthalmologists to the rural Indian population is 1:250,000. The vision centers are equipped with basic ophthalmic equipments, sterilizers, BP apparatus and internet connectivity. These centers are manned by well-trained ophthalmic assistants who can diagnose minor refraction errors, treat minor ailments and conduct counseling on the eye problem.
These vision centers are actually manned with two people. One is a trained ophthalmic technician and another one is the coordinator who can take care of the administrative activities at the vision center, and the center promotion will be done by one field worker who is working in the field.
Coming up after the break, the Piramal Prize 2008 weekend at IIM Ahmedabad.